In this video, I want to talk about the end-to-end patient journey. What do I mean by the end-to-end patient journey? What often people find difficult to understand, and they are surprised when I explain to them how complex it is to serve a single patient. Why? Because if you support a single patient to the disease journey from getting sick to getting healthy again, it is impossible for one individual company to provide all necessary services. It requires many, perhaps hundreds of companies who are directly and indirectly supporting that individual patient. And that makes healthcare and life science so complex. Imagine you have a patient. Let's call her Mrs. Yu Yan. Mrs. Yu Yan gets sick and she needs to get better again. What is she going through in her patient journey? First, she noticed she has some symptoms where she feels uneasy. She may refer to a health app which gathers vitals and gives a prognosis. Then she may contact an internet hospital and talk to an AI-driven engine smart system that gathers information and even provides some preliminary suggestions. Plus, she may then talk also through a doctor who works in tandem with AI. Then medical equipment is needed in order to make a diagnosis, typically then in a real hospital. The patient has to engage with a doctor, has to see a nurse, has to see a doctor. Then the doctor, after examination and using various equipments, may prescribe a medication. According to the different disease areas, there are thousands of medications provided by hundreds of pharmaceutical companies. And then she may go through a therapy, again requiring different service providers in addition to hospitals and doctors to help Mrs. Yuan to become well again. And she may have to go back to the doctor for re-examination until she gets well again. Now, this involves many different players, and at each step data is gathered, needs to be analyzed, hopefully properly analyzed, and then the right diagnosis need to be made, the information need to be shared, and ideally that information related to that disease is put into context with the entire health history of Mrs. Yuan. As she assumed 53 years old, she had numerous diseases, she has certain DNA preconditions. The better the doctor understands the situation, the better the solution. And again, I bring up this example. It is impossible for one company to handle all the necessary to serve Mrs. Yuan. So, conclusion, many different companies need to work together. Data needs to be shared. The most appropriate technology, equipment, doctoral experience, nursing, and other services have to work in tandem to help improve Mrs. Yuan's health. And this is where AGS is coming in. We understand the patient journeys. We have worked on numerous projects. We understand how the relationship fits together. We may not have all the detailed answers on each patient journey, but we know where the key points are, where the different stakeholders need to work together. We understand where often communication breaks down, where there are communication and collaboration obstacles, and we know and have best practices of how to address those. So AGS can serve in various roles within the ecosystem on a particular project, as a facilitator, as a change manager, as a stakeholder manager, as a subject matter expert, to facilitate the journey. So typically AGS will get involved, become part of the team, and then with the team develops and delivers a solution together. Typically the engagements are not feasible just for one person to do. Different skill sets, roles, subject matter experts are necessary to address the issues. As I said before, the ecosystem required, the different players required, makes any undertaking very complex. So there are numerous ways of how AGS can and does engage in a typical project. So that can be from a process analysis to the data flow, through the strategic alignment and business modeling, looking at customer journeys, customer engagement, patient journeys, to supporting the above with appropriate technology, and then also driving the necessary change, as it always will involve improvement, alteration, modification of existing behaviors, upskilling people, instructing people, encouraging people, and making sure that improvements are implemented. And putting everything in a context of compliance and quality and regulations, which are crucial in life science and healthcare. So if this topic is of interest to you, I would be happy to have a conversation with you. Over 22,000 professionals, experts, and leaders worldwide are following my insights. I had the opportunity to support, direct, develop, and facilitate on dozens of projects in the life science and healthcare industry. I suggest my insights could be of value to you. If you think likewise, please scan in the WeChat code and connect with me, and or send me a personal email. I look forward to talking with you.